Hi, what's your name?
Hello, I'm Dr. Shehu Gandhi Yahaya, and your patient's name is Aliyu Yahaya.
Aliyu?
Yes,
Oh,
Aliyu
that's nice to meet
Yahaya.
you.
Thanks.
Um, how old are they?
Shekarunka nawa? He is 8 years old.
He's 8? Okay. What does he like to do for fun?
Wai me yake damun kaka asibiti? Ciwon kai da zazzaɓi? Da me kuma? Akwai ciwon ciki ne? Okay. He come to the hospital today morning with complaint of fever, headache, with a convulsion of 2 days, fever and headache of 2 days duration. Then he has convulsion of 1 day duration.
Okay. Is the fever continuous or does it come and go?
Zazzabin nan ya zo yana ta yi maka ne ko yana tsaya? The fever is initially yesterday it was a fever that was on and off, but today the fever was continuous.
Okay. Would you mind taking his temperature?
Yes, the temperature that we took from our record using our thermometer was 37.8 degrees centigrade.
Okay, thank you. Is he experiencing any abdominal pain or diarrhea?
No vomiting, no diarrhea.
Okay. I suspect malaria, so could we run a rapid diagnostic test or a blood film?
Yes, yes, it's a very nice attempt. This child is having malaria because based on our rapid diagnostic test, just like you request here, is showing MPs of 2+. So it's suggestive of malaria, and the fact that the fever is continuous. Will you also wish to perform another investigation? Because malaria, fever in malaria is usually continuous, but in this child, yesterday the fever was on and off, which is in keeping with malaria. Malaria fever is on and off, intermittent fever, while today the fever continues to be persistent. It becomes a continuous fever today. So because of having a continuous fever that is increasing in frequency, what did you suspect again, apart from malaria?
Could he maybe have an ARI? Is he experiencing any congestion?
No nasal congestion.
Okay. Maybe anemia could be one of the side effects of malaria?
Anemia is but in his own case, his PCB is 35%. He's not having an anemia. But
Okay.
from hearing the word continuous fever,
Okay.
there is
In
another
that case,
sickness that usually comes with continuous fever.
yeah. In that case of a continuous fever, it could be typhoid. So could we also run a blood?
Yes, excellent, excellent, excellent. So usually our patients here in Nigeria, they present with co-infection. You find them with both malaria and typhoid. That is enteric fever.
Okay.
A good name to call it, we call it enteric fever because it is caused by many species of the typhoid, like Salmonella typhi, Paratyphi, Typhimurium. So, and a host of them, about 8 species, both of them cause typhoid. So, to confirm if it is actually typhoid, is there any investigation you may wish to do?
We could run a blood culture,
Yes.
and then if that comes back positive, I guess we could keep the patient hydrated and maybe put him on like an antimicrobial therapy.
Yes, that's nice. Just like you mentioned, you will like to do a blood culture. When you do blood culture, it will yield the organism, of course, the salmonella bacteria. It will yield it in the culture. Also, you may do a full blood count with differentials. It
Mhm.
will show leukocytopenia. The blood picture will be leukocytopenia. There will be decrease in the number of white blood cell in the case of typhoid fever. And commonly in Nigeria, we run a test called a Widal test. The
Okay.
Widal test usually indicate the titer of the salmonella that is present in the blood. So actually, Widal test, you will take a Widal test this week, then make another test in another week. Then you make comparison. If there is increase in the titer, it means the patient have typhoid. Commonly, we use certain parameters. Widal, once it is 1 over 180, it is significant. So you will see result like 1 over 140, 1 over 160. It means it's not significant, not typhoid. But when the result is like 1 over 180, 1 over 120, 1 over 180, 1 over 320, they are all signifying a positive result for uh, salmonella typhoid. So you run full blood count with differentials. Vidal blood culture is beautiful. The way you make your diagnosis, it is beautiful. You are working along the line. Then how will you like to treat the malaria and then the typhoid?
For malaria, I would like to treat it using an ACT.
Beautiful.
And for the typhoid, I'm not sure I can pronounce this, antibiotic fluoroquinolone. Uh, yeah. And then for prevention, I would suggest wearing long sleeves and bug spray when he's outside. And for typhoid, frequent hand washing.
Yes, that's interesting. Of course, for treatment of malaria, the first line drug for the treatment of malaria is ACT, artemisinin in combination therapy for simple malaria. And also for the typhoid, since it is caused by bacteria, you will give an antibacterial, or let's say antibiotic. Commonly here we give them penicillin based antibiotic like amoxicillin. We discourage giving children ciprofloxacin, that is the fluoroquinolones,
Okay.
because it affects their bone marrow. So it will make the children not to grow well. They will not have a good height. It affects the bone plate. So usually children are not given ciprofloxacin. Instead, we give them other antibiotics like the amoxicillin, which is being prescribed for this child. So basically, antibiotics for typhoid, they
Okay.
do well on the typhoid. Some you have to go parenteral. You first of all give them intravenously, that is parenteral, for some, let's say a week or so. Then you continue them on oral amoxicillin also.
Okay. Thank
And for the prevention is beautiful, just like you mentioned. And for the typhoid, hand washing is very important because we get in contact with a lot of contaminants that may contain bacteria. If they don't wash their hands very well, they eat, and usually the route of transmission is fecal-oral. You can either get typhoid through the oral cavity, or you can get it through washing. If the child pass defecate, if he excrete and did not wash his hand after washing the, commonly in our culture here, we don't use toilet paper to get rid of our feces after defecating, but
you.
usually we wash using water inside a kettle. So actually the person who washed his uh who washed after excreting should also wash his hand with antiseptic or soap and water, soap and clean water. If not, the bacteria may be contained within the excreta, and when he comes and eat food without washing the hand, he still contract the bacteria back. And also you advise the parent on drinking good and potable water. Here in Nigeria, we don't have good water supply, more especially people who live in the rural areas. They not all of them have good pipe-borne water supply. And also those who live in overcrowded places, you find out that the water is not enough. They don't have good water. So children may drink water from the well, which may contain bacteria. Some even drink water from rivers. Those waters are not purified. So you discourage them from drinking non-potable water, water from rivers and well. And also you also encourage them not to be patronizing food sold from food vendors. It's common within our society that there are people who fry beans cake, that is, we call it akara here. Those uh, who fry yam and sell it outside, those who fry groundnut and the rest, they sell it outside. You don't know the hygiene of those who fry those feet. So if you are not sure of the hygiene of those who make those feet, and once they buy it and consume it, they easily contact the typhoid fever. That's why typhoid is usually common from those that are within the age of 3 years and above, or let's say 5 years and above. Those below it hardly contract typhoid because they are the ones that usually buy ice from outside, buy donuts and other things from outside, and you are not sure of the hygiene. So those are the other good advice you wish to give them. And this child also complained that his parent complained that the child convulsed once before he come here. So convulsion is when the body is shaking. Some of them you find out that they have generalized tonic-clonic contraction. So what we usually do for children with convulsion is we abort the convulsion using IV diazepam. We give them diazepam intravenously. So when you give them the diazepam, it is a muscle relaxant. It will relax their muscles and they will, thereby stopping the convulsion. So far our discussion has been excellent with you. You have tried tremendously. I hope you also want to be one of us, a doctor, of course. You know,
Well,
US doctors are the best. So I wish you will join the club.
I'll try.
So you're welcome. I don't know if you have any other contribution you may wish to make.
Oh, I think is his parent there?
You said
Excuse me?
hello?
Oh,
Did
hi.
you say anything?
Oh, I asked if his parent was there.
Okay, okay. With this, you are okay. At least I'm satisfied with your contribution. If you don't have other business on the patient, it's okay. I'm really happy. Keep it up.
Thank you.